Hi and welcome. My name is Kate Rose. I'm your host. Our podcast today, Home Care Today with 21st Century Healthcare Consultants. I have a very special guest with me today. This is Jacquie Strupp. Jacquie is an agency solutions consultant. We had a lot of conversation before we came on air about what she does, why she does it, and I'm looking forward to getting to learn about you and how you are with what you do. And so let's just jump right into it. Give me a brief overview of what it means to you to do the job that you do at Alora Software.
Yeah, absolutely. So for me, the reason why I'm in this industry and why I'm with Alora is that I like to help agencies. My goal is to make sure that we're providing them with a product that is going to help streamline their day-to-day activities within their agency. And the reason why that's so important to me is I came from an agency that was on paper for a lot of years.
Now, what do you mean by that?
So being on paper means that you do everything manually. You do your assessments manually. Your nurses are doing a lot of extra work because they're doing assessments. They're writing out plan of cares. They're writing everything down. And then that information has to come into an office setting, and people within that office have to translate that information into electronic documents or into electronic systems. And I will say that if we had had an EMR in our agency at the time, we probably would have eliminated half of our staff. And I don't say that in a good way, like, hey, I didn't want my staff to be there. I didn't want my colleagues to be there. But from an agency perspective, especially when you're running your own business, that frees up a lot of revenue or money to put in other places rather than having to hire people within the office to manage all of these paper trails, when you could have it done in an EMR system that makes things a lot more efficient too.
Give me a brief overview of the features and the capabilities of Alora Home Care software that sets you apart from other software platforms in the industry.
Absolutely. So ease of use, that's a big thing with Alora. And I know, there's a lot of companies out there and they say, oh, we're easy to use, but I've used several software systems, and just being able to sign into Alora and see exactly where you're at, see the menu items, navigate through it very easily and quickly, learn it very easily is very important. Some of these agencies, they don't have any clue what an EMR system is, or they haven't used one previously, especially if they've been in home care or home health for a lot of years. They're used to paper. And so for them, we really need to be able to give them a system that it's easy for them to sign into and see, like, oh, well, I don't know it right away, but it looks like it's easy to use. So that's one part of it. The other big part for Alora is our customer support. So our CEO, Satish, developed Alora with the expectation that we would provide just untouchable support to these agencies. And he did that by making sure that we only hired people that have home health experience on the back end of their resume. And then now they're coming to Alora, and they can help service these agencies by knowing what it's like to be in their shoes in the office. So our customer support is by far the best in the industry. And I say that with complete confidence because I've sat on hold with other EMR systems for 3 hours sometimes, or 4, waiting for someone to answer the phone so I can get some help within an office. And that is not how it is at Alora. We answer the phone, you call in, you're not getting a voicemail, you're not submitting a quote unquote ticket. You're actually getting someone who's going to talk you through something, show their screen, and help you. And that is a big, big thing that sets us apart from other software companies in the industry.
It almost sounds like you're describing a partnership.
Yeah, absolutely. And I think that that's why we connect so well with 21st Century, because 21st Century consultants, they're partners to these agencies, getting them off the ground and running, supporting them, helping them to understand the things that they don't necessarily understand, and being that bridge to get their business up and running. And Alora comes in and says, okay, now we're going to take the reins and we're going to help you move over and actually start moving into your day-to-day operations and have a system in place to help that make that easier for you.
So give me some specifics of what Alora software actually enables the end user to accomplish.
Absolutely. So they're able to keep their patient records electronic. They're able to manage their employee records, which is very important for compliance and survey for agencies. They have to have those employee records in place. They have to be able to track credentials and make sure that those credentials are not expiring, which is what Alora will help them track and help give them notifications for those types of things. They're able to schedule. They're able to bill. That's huge. A lot of software companies, they don't have the billing built in fully, where an agency can bill every payer across the board. And that's important for revenue management. Alora can do that. We leave it open and customizable to the agency so they can put in any payer they need to and bill out of their system with either on their own or with the assistance of the billing company that partners with us in 21st Century, which is Symmetry. So very seamless. So it's just an all-in-one system that will help those day-to-day operations for them.
So you talk about what sounds like a collaborative culture.
It is.
If I'm new to Alora, what training resources are available to me as I begin to implement and integrate Alora into my existing business?
Yeah, absolutely. So our training team is great. They will, initially when an agency signs on board with us, they will call them. They will do a discovery call. Aside from whatever information they already have about Alora, they're going to do a discovery call with questions and really dig deep into understand what the agency knows, what they don't know, what they're going to need help with, what their strengths are, the weaknesses. And then they develop a unique and specific training course for that agency to make sure they're successful. Our training team meets with them. We have our support team. They go through modules. They go section through section. Then they do like a question and answer after those sessions to make sure they really did understand what they were learning. And if they don't, they kind of push them back through. And we make sure that they are comfortable and not just releasing them and saying, hey, just figure it out. Mm-hmm. That we make sure that they know and they understand and that they have that continuous support. And I think that's very important because some companies I've heard do not do that.
So when you talk about continuous support, so we have the initial implementation training, and then let's say 6 months down the road, they need to know more, or there's an upgrade to Alora. How do you all handle that?
Oh, yeah. So we make sure anytime we're making changes within the software that we're announcing that to these agencies. So what we do is when they sign in, the first time each day for I think like 3 or 4 days, they have an announcement pop up saying, hey, we've changed this, we've added this, we've done this. These are the new features. If you have any questions, give us a call so we can explain them to you. And then, with that support, if, someone's not understanding something or there's a new feature and they're like, I can't hear you right. I don't know what you're saying. I don't know how to do this. We get on screen shares with these agencies and we show our screens and we walk them through that. We make sure that they are comfortable understanding what we've done to change the software to better improve for what they need. But sometimes they need a little bit more help understanding. So we make sure that we're right there, we're person to person, and we're getting that explanation to them.
Just off the top of your head, how long would you say it typically takes someone to transition into full use of Alora software?
And that's a good question. It really does depend. I mean, we have startup brand new agencies that come on board with us that have never ran a home care agency or a home health agency. They may not understand the ins and outs. And so for them, they're a new agency. It may take them, anywhere from 1 to 3 months. Typically, we're seeing about a 4-week period for them to get trained in the software, but it could take longer. It just really depends on the person. For our larger established agencies, there's a lot of more moving parts for them, right? They've got to transition their patients from the current software they're in or current patients off of paper. They're transitioning those all in. They're learning the software. They're getting their team acclimated to using the software, especially if they're on another system. It can be difficult. They've got to, their team has to adapt. You know how to do something one way, and then all of a sudden you're being told to do it something different. Even if that other way is better, it's still, it's a challenge.
It's a change.
It's a change. It's a challenge. I know I don't do well with it. And so, sometimes those transitions can take anywhere from 3 to 6 months, sometimes a little bit longer, depending on the size of the agency. But we're there to support them. And I think that's the key point when we come down to it, is that they need that support. They're going to get that support from us. So we don't just kind of give them the modules and say, well, figure it out, call us if you need to, and we're not going to answer, and leave us a voicemail, but we might take 2 weeks to get back to you. We're actually actively working with them, helping them, supporting them to get through and understand the transition and the new software in place.
How long have you personally been working with this company?
So this year will be 7 years. So I love Alora. I love the atmosphere. I will tell you that, I didn't come from a sales background, and that's kind of where I'm at right now. Agency solutions. sales, bringing in new agencies, educating those new agencies. But the company itself is amazing. Our CEO is the atmosphere within our company is a family unit. It really is. We all look out for each other. We support each other. If I need help with someone, because my background is not in billing for home health, but I know that there's other people on our team that are, and I reach out and I say, hey, look, I've got these questions. I'm not really sure if I'm going to give them the right answer. Oh yeah, we've got you. Let's jump onto that call with you and let's make it happen. Let's figure out what they need. Let's see if we can help them. Let's see what we can do. And so that atmosphere alone within Alora, and having that support and having someone that we feel cares about us and our success as well, it's just, there's nothing you can't compare.
Well, would you say that type of culture that you experience corporately, you can see that trickling down to your customers? And then can you imagine how even beyond that, to the end user in the field, the patients, the people who are actually receiving the benefits of a well-run organization that Alora, for example, enables and empowers for them to do a good job? How does that make you feel?
Yeah, it makes me feel great. It makes me feel happy about promoting Alora and, and ensuring that these agencies are using something that's going to help them. And it does, it runs down into if we're working as a team and we are all supporting each other and being successful, obviously, what does that do to the end user, right? We're working together, we're bringing up ideas, we're listening to our agencies, we're hearing them say, hey, you know what, this might make life a little bit easier if you added this to the software. Okay, well, we're going to meet every Tuesday with our development team, and we're going to talk about, hey, this is what we're hearing. This is what they're suggesting. We feel this would be of value to multiple agencies across the board. Let's go ahead and push it through and get it developed. So really, all of that teamwork in our end really does trickle down to the end user, because we're listening and supporting, and we want them to be successful. Because honestly, if they're not successful, are we? No. So it's so important. And it's very evident with our agencies. So
I had a chance to chat with Jacquie for just a couple of minutes before we went to air today, and I learned that she loves animals. In fact, she actually went to school to work in the veterinary field. So she has a heart for other creatures, and that includes human beings. And I can hear that in your voice, that you're excited to work for a company that cares not only about its employees, but also about the deliverables and services that they provide, and make sure that the end user, who would be that patient who's in that hospital waiting room, or who's in that lineup waiting to get lab results, or needing someone to come in and take care of their mother or father or whatever, that you seem to be a good fit for what you do.
Yeah. Thank you. Thank you.
Yes. So just very quickly, walk me through what the process would look like if I pick up the phone and I called you and I said, all right, Jacquie, our agency would like to become partners with you. We want your product, we want your services to become part of how we operate our business. What does that incoming process look like?
Yeah. So what I would do is just make sure that they understand, the flow and what they're needing Alora for, making sure that I also do make sure that they're ready for Alora. That's the other thing. So I'm agency solutions. So I'm looking out for them. So especially with, 21st century, we've got a lot of entrepreneurs here, and they come here to these boot camps and they're like, okay, I'm ready. Let's go. Let's sign up for Alora. And I'm like, well, hold on a second. Where are you at in the process? Have you submitted for your state license? Have you done any of that yet? Oh, no. We're working on that. I'm like, okay, well, you're about 6 months out. Let's back up here. You don't need Alora yet. I don't want to sign you up. I'm not going to. I don't think you should be paying for something, especially as a startup agency where you've got other budgets and other things to worry about. You shouldn't be paying for a system you don't need. So I'll determine that first. If they are indeed ready to go, I start working with them. I reach out to our implementation and training team. I let them know, hey, we've got this new agency coming on board. I give them the information that I have about the agency, discussion calls that we've had with each other, so that they're aware and prepared for this new agency coming on board. I let the agency know they'll be getting a call from our training implementation team. They reach out, they do their own discovery, they get them on the schedule to start training, and they start moving them forward from there. And I always tell the agencies, hey, look, you're going to be in training, you're going to have support, you're going to have a lot of things going on. But if you ever need any help, or you ever need to, come back to me and ask me questions, just pick up the phone and call me. I'm here. I'm still agency solutions. I'm still going to help you out with whatever you need. I want to make sure you're successful. If you feel like at any time that, you're kind of lost and you're like, I just want to vent to you, which I have that all the time. They call and they're like, I don't know what I'm doing. I'm not cut out for this. I'm like, yes, you are. You just need to, breathe, calm down, take some different steps. So, you know what I mean? Like, I'm there for them. That's truly what makes me feel good. Obviously, like you said, I was taking care of animals. So it's with people too. I just want to be that person they feel like help them with something, and that they can go back and say, you know what, Jacquie just really, really helped me through this. It really guided me, really supported me, made me feel like I could keep going. And if I needed help with anything, if I needed to get, some feedback on a survey or something, she found the right people to give me a call and be there. So that's where I'm at.
So that's what lights you up.
Yes, it does.
That's what lights you up.
It does.
In the last couple of minutes that we have to chat, is there anything else about, we've heard a lot about Alora software, but is there anything else about the industry and how Alora interfaces with it? Any aspect that you would like to share with people and that gives them the sense that your company would be able to help them realize not just the bottom line, but also to help them feel like they're doing a job that means something more than just money?
Yeah. In my experience, most of the people that are in this industry are here to help. They have some type of story, some type of background that they've come from that has pushed them. They've had a parent that's been in hospice care. They've had a parent that had home health, and they weren't really happy with how their parent was treated, or how they, what it looked like for them at the end. And so these people have that in them, their heart, and that drives them to open up these businesses, right? So that they can actually provide the care that they felt like maybe their family members should have received if they didn't receive good care. So in that aspect, Alora has a lot of that in their own background. And so for us to understand what that agency is needing and feeling, we have that where we're able to empathize, right? And so I think when it comes down to it, we have the background, we have the education, we stay up to par on everything that's changing in the healthcare field. We're able to provide that real life experience to them so they can see that, hey, I can do this. I've got all these people in the background with Alora that have that experience, whether they've been in the home health office as an administrator, whether they've been out in the field as a nurse. We have nurses that are on board with Alora. We have people that have been IT for healthcare agencies, or IT for other healthcare related softwares. So we have all of that experience. So when they're with us, they know that any given time or any turn of the corner, there's someone that understands what they're going through. And that's really what we pride ourselves on. That's really what when we're supporting these agencies, we're telling them, be comfortable with us because we're here to help you. But we also have the knowledge that maybe we can gap that bridge for whatever knowledge that you don't have or already have, or emphasize, or what's the word? I'm trying to think of the word. Build on that knowledge that you have already in the industry. So that's kind of where we stand, I think.
Well, I think that anybody who has been in the situation that you referenced, like a parent who needed help or a personal experience, that helps bring people together. And that's what the healthcare industry ultimately really is. It's about people helping people.
Yes.
And never losing sight of that drives everybody towards success, not just financially, but also just in terms of what we're doing here on the planet.
Right.
So I appreciate your time.
Yeah.
Thanks for stopping by.
Of course.
We've been at the boot camp here in
you.
January for 21st Century Healthcare Consultants.
I'm so happy to be here.
I've been talking with Jacquie Strupp. She is an agency solutions specialist at Alora Healthcare Programming and Software. I'm Kate Rose. We hope to see you again next time. Be sure to like and subscribe. Have a great day.